Benfotiamine is a fat-soluble compound altered by gut enzymes and broken down into thiamine by red blood cells or in the liver. Also known as vitamin B1, thiamine plays a vital role in many of the body's functions, including energy metabolism and protecting the brain. It is also involved in neuronal communication and activation of the immune system. The lipid solubility of benfotiamine shows higher bioavailability compared with an equivalent dose of water-soluble thiamine. Hence, it is considered a better option to treat thiamine deficiency to manage certain health conditions. So in today's video, I'm going to share 6 health benefits of benfotiamine, the recommended dosages and contraindications. Let's get started. Hello and welcome to another video. If this is your first time here and you want to achieve an optimal state of health within your mind and body with a little help from Mother Nature, start now by subscribing and clicking the bell so you don't miss any future uploads. 1. It inhibits complications from diabetes. High blood sugar levels can lead to vascular damage, including through the accumulation of advanced glycation end products, or AGEs. This can lead to diabetic neuropathy, a severe complication of diabetes characterized by nerve damage. Although it increases insulin levels and the breakdown of sugar, the most promising benefit of benfotiamine in diabetes comes from its ability to block the production of AGEs. Some early research suggests that benfotiamine on its own or with vitamins B6 and 12 can be used as a strategy to ease symptoms of nerve damage in people with type 1 or type 2 diabetes and to potentially prevent the condition. This effect has been supported by a few studies, however some revealed mixed results. One was published in Diabetes Care, where type 2 diabetic patients consumed 1050 mg of benfotiamine daily and were given a meal high in AGEs. The results indicated that it has a protective effect against oxidative stress induced by high levels of dietary AGEs. This effect can be further enhanced when paired with slow-release alpha-lipoic acid, according to a study on 9 diabetic patients. Other studies on over 250 patients with neuropathy, 6 to 12 weeks of benfotiamine supplementation improved nerve damage and its symptoms, including pain. However, 2 clinical trials in 90 diabetics suggested it did not improve nerve damage. With this in mind, discuss with your doctor if you should supplement with benfotiamine for diabetes. 2. Treatment of Alzheimer's disease. Amyloid plaques and reduced glucose metabolism are key aspects of patients with Alzheimer's disease. Benfotiamine has been shown to reduce amyloid buildup in animal studies. A small clinical study published in Neuroscience Bulletin, where 5 patients with Alzheimer's disease took 300 mg of benfotiamine for 18 months, showed cognitive improvement in all 5 participants. These results indicate that benfotiamine may be beneficial in the treatment of Alzheimer's disease. However, more human research is needed to assess whether it can halt cognitive decline. 3. It's helpful for overcoming alcohol dependence. A long-term drinking problem can lead to thiamine deficiency, which impairs cognitive abilities and psychological well-being. It's also associated with severe deficiency of vital nutrients and vitamins. Studies have found that a high daily dose of benfotiamine can help curb drinking in people with an alcohol use disorder, as well as easing mental distress in those who are recovering from severe alcoholism. This is supported by another study where daily supplementation of benfotiamine improved symptoms of depression in 85 long-term alcoholics and reduced drinking in 21 alcohol-dependent women. Benfotiamine may also improve nerve damage caused by alcohol, according to 2 trials on almost 100 people. When combined with vitamin B6, it was also effective in 2 trials on over 300 people. 4. Benfotiamine for smoking. Smoking leads to endothelial dysfunction, an early event in cardiovascular disease. This is exacerbated by oxidative stress and inflammation. Benfotiamine has the potential to reduce these harmful effects. According to a preclinical study on rats, benfotiamine was found to prevent nicotine-induced vascular dysfunction. Another research has demonstrated that short-term benfotiamine supplementation can partially restore macrovascular function in healthy smokers. 5. It promotes kidney health. Kidney disease or nephropathy is one of the most dreaded complications of diabetes. When kidney function deteriorates in diabetic patients, the kidneys may no longer be able to filter urine. As a result, diabetic patients with advanced nephropathy must resort to kidney dialysis or kidney transplant. Benfotiamine protects the kidneys against oxidative stress and loss of filtering capability, thus helping to prevent diabetic kidney disease. According to a 24-week study, the addition of benfotiamine into the diet produced beneficial changes in markers of kidney function, including a reduction of oxidative stress associated with diabetes and a 50% decreased expression of AGE levels. 6. It has anti-tumour properties. Benfotiamine has the potential to halt leukemia by a mechanism called apoptosis cell death. A cell culture study at the Kanazawa University in Japan found that benfotiamine is a promising supplement for acute myeloid leukemia patients who are not eligible for standard chemotherapy. It was also noted that benfotiamine showed synergistic activity with cytarabine, a chemotherapeutic agent, to eliminate myeloid leukemia cells. Dosages and contraindications. There is some concern that benfotiamine supplements may trigger certain side effects, such as upset stomach, nausea, and decrease in blood pressure. However, it has been well tolerated with no serious side effects in most human studies, where participants with a variety of disorders took doses between 300 and 900 mg per day. Effective doses fall in the range of 300 to 600 mg, so beginning with a lower dose and observing the effects is a good approach. While not many dangerous side effects have been reported, getting into extremely high doses is not recommended as its safety has not yet been researched. Benfotiamine is known to contain sulfur and should be avoided by anyone with a sulfur sensitivity. Bear in mind that the safety of supplements in pregnant women, nursing mothers, children, and those taking medications has not been established and should also be avoided. If you're considering taking benfotiamine, speak with your healthcare provider to determine if this supplement is right for you. Are you a health nut? Join the Health Nut Hour today, subscribe to my channel and click on the bell notification, and I'll keep you updated on future videos. See you in the next one.